So, doctor, can you briefly and shortly explain the process of IVF with egg donation? Like we people do understand how an IVF cycle happens. So, what is different in IVF with egg donation in terms of the cycle?
So it's like preparing for an embryo transfer as far as the recipient is concerned. So if what we usually try to do is synchronize the oocyte donor and the recipient cycle. So we try to match their cycles in such a manner that when the stimulation for the oocyte donor is going on, simultaneously at the same time we're trying to prepare the endometrium of the recipient. So that when the oocyte retrieval of the donor is done, at that time we usually start progesterone for the recipient. So it's basically just taking a few medicines from day 2 of the menstrual cycle till day 12 or 13 of the menstrual cycle, and then starting progesterone for about 5 or 6 days to undergo a blastocyst transfer. So it's synchronization of the cycle and just taking tablets. So it's not any different from any typical pure embryo transfer cycle.
So, how much time does this entire process of donor matching to stimulation to the actual embryo transfer take?
So donor matching usually takes about 2 to 3 weeks. It'll depend on, if you have a donor of your own, then it's not going to take time at all. But if you're approaching an ART bank and asking them to recruit a donor as per your specific requirements or specifications, then that might take about 2 to 3 weeks. Once you've finalized your oocyte donor, then it's all about synchronizing the donor recipient cycle. So that takes another 2 weeks or so. So from the point of approaching an ART bank to actually undergoing an embryo transfer, usually you'd be looking at somewhere between 8 to 12 weeks.
So, if the patient is from a different city, how many times do you think a patient would have to visit the clinic, starting from, say, from the very first consultation to the time the embryo transfer takes place for a IVF egg donation program, of course?
So, for our distant patients who live far away, we usually do most of what is to be done initially over online consultations or telephonic consultations, because it's about deciding which parameters to include while selecting a donor and all those formalities and shortlisting a donor. So for all that, the patients don't need to come or visit the IVF center. It's actually when synchronization of the cycle starts, that is when the donor and the recipient are required to come to the clinic. So roughly in about 3 to 4 visits, an embryo transfer cycle with oocyte donation can be easily done.
And for these 2 to 3 visits, like, do they have to come and spend 2-3 days for each visit, or is it just a few hours every day?
So as far as the recipient is concerned, we usually call them for a scan on day 12 or 13 of starting the medicines for preparation of the endometrium. So that's just one scan, so they can come for the scan and go on the same day. The husband has to come on 2 occasions. One is for cryopreserving the semen sample, and the other is actually when the oocytes are being fertilized. On that day he has to come and give a semen sample. And so they basically can come and go on the same day on these 3 occasions. On the day of embryo transfer also, the recipient just has to come and can leave on the same day, or if at all they live very far away, then probably leave the next day. So in 3 visits they can just come and go on the same day. In the 4th visit, on the day of embryo transfer, probably staying for a day makes it a bit easier for the recipient couple. So they don't have to stay for 2-3 days on any occasion.